Hello everyone, Dr. Boris Nektalov. I'd like to go over another x-ray with you guys of a patient that I've taken who came in to us with neck and headaches, severe migraines that's been suffering for years. So this patient comes in, we again like to educate you guys what normal is in order to understand what's abnormal is. So when we're looking at x-rays from the side view, we're looking for this type of a curve. Very important, your brain sits here, the spinal cord passes through. In between each bone, this is vertebrae. So we have 7 different vertebrae in our cervical spine. In between each bone, we have what's called disc space. On x-rays, we cannot see actual soft tissue or disc. We can see the disc spaces. When we're seeing disc spaces, we can predict whether the disc is compressed or not based on that space. When we're looking at her x-rays, first thing we're seeing is she has, if you see the red dotted line, her spine is reverse curve. Normal curve should be where the green line is. That's the first thing that we're looking at. The second is we have this bone that's called atlas. That's the first vertebra. In between the skull and the first vertebra, we have the space. There's a nerve that passes through here, which is called suboccipital nerve. If it's compressed, people feeling headaches. So in her case, this bone and the skull, which is occiput, is so compressed that in my experience, when somebody is having a pressure on the nerve due to mechanical issue, and if we can move that bone, take the pressure off, the pain goes away, the headaches improve. As long as they can improve their posture, they will see improvement in their symptomatic situation in their spine. When we're looking at the front of the spine, again, from the front, this is normal. We're looking for the spine to be straight. The skull should be aligned vertically. So this is hers. If you look at her spine is deviated from the midline. Anytime your spine is deviated, your spine has to compensate to hold that midline. That puts a lot of pressure into the spine. So in her case, we were able to achieve what she came in here for by addressing the spinal alignment. If you'd like to see your spine to be evaluated by a professional, give us a call, email us, send us your x-rays. We'll be happy to review it for you.